kind of like a not great secret of the healthcare system, is something called inter-rater reliability on chart
Hmm.
reviews. And let's say your healthcare organization is going to be doing a study on your healthcare conditions. Well, before that happens, somebody has to do a chart review of your chart and determine, do you have the disease in question? Are you doing well? Are you doing poorly? And to what degree you are? Do you have side effects that are going to be rule you out from participating in this study? Do you have a secondary condition that's going to rule you out of this study? And so what they do is they have people with clinical experiences, doctors, PhDs, nurses, and they cross train all these people. And I just heard at that same conference that a large institution has 50 full-time employees that do nothing but this, right? So these chart reviews are important for research organizations. And the naughty secret about chart reviews is that when you have two people do a chart review, they will get the same answer about 85% of the time. Sometimes a little less, sometimes 70, right? And sometimes a little more, 90. And then I'm talking about like consistent, like if you have those 50 full-time employees and you test them on the same records again and again, and you see how often they agree about what they say. You would think, based on clinical topics, that it would be something like 98% or 97%, which is in other industries where complex situations need to be evaluated, they create these rules of thumb and they get up into the 90s, high 90s. But in chart reviews, it's very low. 85 is a normal number, 80% is a normal number. And that's
No,
not great. It's not
and
great
it's true.
because
Data
when
can
you do a
validate that.
study, it doesn't matter if you're going to do an observational study and you're just going to look at the data, or if you're going to then use that as a recruiting mechanism to recruit people into a clinical trial. It's kind of foundation is what is the starting status of the patients. And then later we're going to do math. We're going to put one of these, we're going to randomly assign people to this group. We're going to do all the work of doing a study of the 6 or 7 different permutations of study types. They're all grounded in this chart review process. At this conference, what they revealed, what is the news to me, is that they trained several off-the-shelf ChatGPT, but also some of the large language models that you can just download onto your laptop and run. And they got up to guess what percentage of inter-rater reliability between the large language model and the people. It's 85%. And the problem I see with that is it's one of these cases where we have not properly gotten human intelligence to solve a particular problem. We have this really complex problem that we kind of all live with when we're doing healthcare research, that people can look at the same healthcare record and see different things. And now what we've done is we've figured out a way to make a large language model kind of stand in as one of these reviewers. And of course, when you have 50 full-time employees doing some
So you
complicated
have
thought work and you
85%
realize that you can
faster.
85% faster. And you could also scale it out, right? You could fire half of your human raters, keep half of them, and then not just have 25 replacing them, you could have 250 replacing them. And you can say, hey, AI, why don't you evaluate this chart the same way Mary does when she's having a bad day, like when she's got a hangover, or when she's feeling particularly negative about people with diabetes, whatever it is. Like, you can intentionally introduce bias to these 250 large language models in order to remove bias from the system as a whole. And then you have say 50%, 30%, or 10% human, but what they're really doing is validating that the large language models are not going too far askew, right? You're just keeping a human in the mix to keep it from going crazy. And you would improve probably your overall chart reviews, probably. But the improvements are limited to what human intelligence was able to accomplish, and human intelligence has not been able to solve this problem. So my concern is, as I'm hearing this, is I think the insurance adjudication process is of concern to me. I think the chart review adjudication process is of concern. And in all of these cases, we are going to be in a place very soon where we're taking humans out of the mix without ever having gotten to something that is fair and equitable and reasonable and reproducible and decent to patients and to providers and health insurance companies. I'm not interested in having just whatever the patients say goes, but certainly we are not at a place where the patients are fully respected.